95 out of every 100 fever cases in Lagos have absolutely nothing to do with malaria. Does that statement make your jaw drop? It should, because for countless years, many people living in the energetic and sprawling metropolis of Lagos, Nigeria's most populous city, have held on to a steadfast belief. If you develop a fever, it must be malaria. Yet the Lagos State Commissioner for Health, Professor Akin Abayomi, has recently come forward to shatter that age-old assumption, turning conventional wisdom on its head. So, what on earth is going on here? And how could this revelation reshape not just the lives of those in Lagos, but also ring alarm bells for the global health community? Today we delve into one of the most riveting discussions to come out of the region. Why almost all fever cases are apparently linked to something other than malaria, how misdiagnosis of fevers has led us toward what scientists call the silent pandemic of antimicrobial resistance, and what an exciting new strategy called Test, Treat, Track has in store. Brace yourself for a deep, eye-opening exploration of a health revolution that might just spare countless families from tragic and preventable loss. Now, before we immerse ourselves in the heart of this unfolding saga, here is a quick roadmap of what we will be unpacking. First, we will reveal the background behind the mesmerizing statistic that 95 out of every 100 fevers in Lagos are not malaria. We will see how this has caused a mental shift among healthcare providers, prompting them to reevaluate everything they thought they knew about fever management. Then, we will peel back the layers of an overlooked crisis, the looming threat of antimicrobial resistance. We will reveal how a simple fever can lead to overuse of antibiotics and antimalarials, essentially fueling a global problem that could make some infections impossible to treat in the near future. And finally, we will shed light on how the new approach, Test, Treat, Track, could free Lagos, and perhaps beyond, from the stranglehold of untested assumptions about fevers, and usher in smarter, safer medical oversight. Sounds critical? It is. So, let's do this together and uncover the secrets behind one of the most important health stories of our time. Picture a busy Lagos street, open-air markets brimming with fresh produce, vendors hollering about their wares, and an endless dance of cars, buses, and people determined to keep up with the city's daily hustle. In the middle of it all, a person feels their forehead heat up. They sense that distinct flush of fever. Almost by reflex, they assume they have malaria and might dose themselves with anti-malarial medication. If you grew up in Lagos or have spent time there, this pattern might be all too familiar. That is precisely why the news from the Commissioner for Health hit like a bolt of lightning. According to researchers, up to 95% of these fevers are not caused by malaria, meaning that for every 100 people who assume they have the dreaded mosquito-borne illness, only 5 truly do. The rest might have pneumonia, a gastrointestinal infection, dengue, a viral illness, or something else entirely. How did we get here? For decades, the entrenched narrative has been that malaria was the #1 cause of just about every other fever in certain parts of Africa. And given that malaria is still a dangerous and potentially life-threatening disease, many people have advocated for caution. It is better to treat the condition quickly rather than let it fester. Unfortunately, this over-readiness to deploy anti-malarial drugs has come at a cost. When patients are given medication they do not actually need, it contributes to more than one serious problem. One is the waste of resources. These drugs are not free, and in many cases, people might not complete the entire recommended dose if their fever subsides, contributing to the potential of partial treatment. But the more threatening issue is that parasites and bacteria can develop resistance to medications, meaning we lose our arsenal of effective treatments bit by bit. At the center of all this is the dire warning about antimicrobial resistance, or AMR for short, that experts like Professor Akin Abayomi and his colleagues fear. AMR describes what happens when microorganisms, like bacteria, viruses, fungi, and parasites, become resistant to the medications that once easily subdued them. It starts small. Maybe the antibiotic that worked last year is now only half as effective. Then the problem grows, evolving into a scenario in which entire categories of drugs fail to kill off infections as they did in previous generations. When we casually toss around antibiotics or antimalarials without a proper diagnosis, we accidentally train these microbes to become more resilient. It is a little like teaching them how human tools work, so they can overcome them more swiftly next time. The results can be catastrophic if left unaddressed. To paint a sobering picture, consider the childhood pneumonia example. This is an infection that can look a lot like malaria to the untrained eye. A child may have a fever, chills, fatigue, common signs that someone might suspect is malaria. Without a proper test, a parent might rush off to grab an anti-malarial drug from the nearest pharmacy. Meanwhile, pneumonia is not receiving the correct antibiotic treatment, and the child's condition could worsen at an alarming pace. This sort of tragic misdiagnosis can mean the difference between life and death. That is why the 95% statistic from the commissioner has been described as a wake-up call. For years, the city has been operating under the assumption that fever equals malaria, when in fact many children and adults might require completely different treatments. The key question then becomes, how does one break this habit? How do you move from a knee-jerk reaction of, "it must be malaria," to a measured, test-based approach? That is where the test, treat, track methodology steps in. Under this new pathway, healthcare providers, and hopefully communities at large, will perform a rapid diagnostic test the moment a patient comes in with a complaint of fever. That small device, known as an RDT for malaria, can give quick guidance on whether the parasite is present in the bloodstream. If the test is positive, doctors can prescribe the correct anti-malarial medication. But if it is negative, the entire approach changes. They switch gears, investigating the possibility of other infections that might be the culprit, such as respiratory infections, typhoid, or other bacterial or viral threats that flourish in environments where sanitation and humidity challenges blend with large urban populations. Alongside that shift is a renewed push to crack down on the free-flowing sale of antibiotics and antimalarials. In many places around the globe, you can just wander into a local pharmacy and pick up antibiotics as though they were no different from a pack of painkillers. This is exactly the kind of unregulated environment that fosters misdiagnosis and drug resistance. The pharmacy staff might not question you about your symptoms or run any basic check. Instead, they hand over the medication, often grateful for your business. But the Lagos authorities are saying that approach must stop, and it must stop now. If no prescription is presented, no medication should change hands. The aim is to enforce stricter rules that will make it impossible for people to pop antibiotics or antimalarials at a moment's notice, especially when there is no testing carried out. All these measures might seem strict, but if you think about the potential upside, it is massive. Fewer people misdiagnosing themselves as malaria sufferers equals more accurate treatment across the board, and that means less wasted medication, fewer cases of drug resistance, and an overall healthier society. If that possibility excites you, do me a quick favor. Reflect on how surprising you find it that 95 out of 100 fevers are not malaria. If that fact alone has you stunned, consider giving this little exploration a positive nod right now. Sometimes acknowledging our collective surprise can keep these vital conversations alive. But there is also a bigger lesson in all this. Malaria is no joke, and it continues to be a top health concern across many parts of Africa. Yet, ironically, over-focusing on it can lead us to overlook other potentially lethal infections like pneumonia, typhoid, or certain viral fevers that present similarly. Historically, Lagos officials have tried to clamp down on malaria with large-scale campaigns, distributing insecticide-treated bed nets, indoor residual spraying, and community health seminars. Much of this has been successful, but ironically, these same campaigns might have solidified the notion that fevers are usually caused by malaria. Thus, even as the prevalence of malaria in major urban centers may have gone down, the mindset that a fever always boils down to malaria remained. Over years and decades, a deep-seated habit kicked in. Run to the pharmacy or a local medicine vendor, buy an anti-malarial drug, treat yourself, hope for the best. But in reality, if the rapid diagnostic test says negative, those precious resources spent on anti-malarial drugs would have been better directed to discovering that perhaps you have a respiratory infection that is quietly raging in your system. In children especially, that miscalculation can spiral into tragedy. One of the heartbreaks the new initiative aims to avoid involves families who lose a child, not because the illness could not have been cured, but because no one suspected pneumonia or some other condition in time. Equally pressing is the risk that widespread antibiotic misuse supercharges the evolution of superbugs. This phenomenon occurs when bacteria too frequently encounter antibiotics, learning to mutate and fight back. Once they morph, the drugs that worked last year may no longer stand a chance. The day such microbes emerge, we will collectively face a new frontier in healthcare, one in which previously harmless ailments become life-threatening. Experts estimate that if we do not reverse this trend, infections that were once considered tame could kill millions of people each year worldwide. That is what leads some to call antimicrobial resistance the next global health crisis, overshadowing even pandemics because it is creeping up slowly and methodically. Of course, we cannot just wave a magic wand and implement test, treat, track. Public health is more complicated than that. Lagos is a city of enormous diversity, with pockets of great wealth and many areas grappling with limited resources. Some neighborhoods have advanced clinics staffed with professionals who can do comprehensive blood work decisively. Others rely on small, informal shops that may be overwhelmed by daily demand and short on supplies. If the city is truly to adopt something like the test, treat, track approach universally, it must provide training, resources, and clear guidelines. Pharmacists or patent medicine vendors must be well informed about the new rules. They must know how to administer or at least direct patients to get a rapid diagnostic test. They must also be willing to turn away someone who wants to buy an anti-malarial drug without any test result to back it up. Here is where the involvement of local authorities, plus supportive partners like the World Bank and academic researchers, comes into play. According to statements, the Pathway to Pre-Elimination and Digitization project aims to empower everyone in the chain of healthcare to do the right thing. That means providing robust analysis and side-by-side comparisons of the older methods, like microscopy, with the newer, more streamlined rapid diagnostic tests, which can be delivered even in areas with fewer medical resources. The scaled-up version of test, treat, track is therefore not just about controlling malaria. It is about demonstrating that a simple, standardized approach can help reduce the time lost in endless self-diagnosis and ensure the city's medical community can accurately map disease prevalence in real time. Naturally, there are going to be challenges. Implementation of new procedures is never smooth, especially in a place as large, crowded, and dynamic as Lagos. One major hurdle is raising awareness. How do you get an entire city with its millions of residents to break out of the old assumption that every fever means malaria and to start trusting rapid diagnostic tests? The short answer is that it will take patience, community outreach, and a gradual shift in public attitudes. Some people might worry that refusing to hand out anti-malarial drugs on a whim could lead to more severe cases of actual malaria going untreated. Others might be suspicious of new testing requirements. Still, public health officials seem prepared to highlight success stories and show that diagnosing pneumonia, typhoid, or a viral flu at an early stage will save lives and money in the long run. Looking one step further, the rest of the continent might be watching Lagos to see how well this new approach fares. If the test, treat, track program is successful, it could become a blueprint for other cities and regions that find themselves in a similar predicament. Malaria remains a serious problem in many parts of the world, so no one is arguing that the disease has been eradicated altogether. But with fewer real malaria cases, the relentless distribution of anti-malarial drugs to nearly every feverish individual poses a giant risk for creating medication wastage and fueling drug resistance. Nigeria, after all, has historically been one of the highest burden countries for malaria, but that burden is not uniform across its enormous population. Urban centers like Lagos do not necessarily reflect the same realities as rural districts with heavy mosquito breeding grounds. By targeting the real cause of a patient's fever, health officials might come to see that the majority of these perceived malaria episodes could be tied to infections like influenza, pneumonia, or gastrointestinal illnesses. The net result will be better medication stewardship. Give the right drug for the right illness at the right time. The stakes could not be higher, because if we fail to adapt, the specter of antimicrobial resistance might grow to unstoppable levels. Maybe you recall the days when penicillin was considered a wonder drug, then bacteria mutated. More advanced antibiotics came into the picture, but those, too, started to lose ground eventually. The cycle continues, and if we do not use these life-saving medications judiciously, we may have precious few options left when a genuinely severe infection arrives on our doorstep. On top of that, there is the reality that respiratory infections, especially in children and the elderly, can turn deadly fast if not identified properly. Early detection through a negative malaria test can be the impetus for further examinations that identify pneumonia or another bacterial infection in time to intervene. If you are starting to see how crucial it is that we all pay attention to these developments, this might be the perfect time for a friendly reminder. If you feel that push for more responsible drug use is overdue, consider subscribing or staying connected so we can continue exploring urgent public health conversations together. One click, or one simple follow, can ensure you do not miss out on future updates that might literally transform the way we understand everyday health challenges. But let us not forget the specifics that kicked off this conversation. Lagos's health commissioner has said that in an average situation, 95 out of 100 fevers will not be malaria at all. That is a jaw-dropping ratio, one that calls for a dramatic pivot from the old ways of doing things. Part of the solution, according to the latest studies from local researchers, is to cultivate an evidence-based mindset at every level of the health system. We are talking about clinics, private hospitals, pharmacies, street vendors, and even the patients themselves. After all, what good is cutting-edge technology if people do not see the value in using it? What underscores the entire movement is a renewed sense of urgency. Lagos is Nigeria's economic engine, and people there do not always have the luxury of taking time off or slowing down to nurse an illness. The city never seems to sleep. That fast-paced lifestyle can be another force that drives the quick-fix mentality. Just pop an anti-malarial drug and push forward, some might say, but the commissioner is calling for a radical shift, urging the public to treat fevers with seriousness and to ensure they are diagnosing the cause accurately. Diagnosing incorrectly, the logic goes, does not just harm the individual. It drains the collective well-being of the entire population, fosters drug-resistant pathogens, and sets the stage for more lethal outbreaks down the line. Researchers like Professor Wellington Oyibo, who also contributed to these discussions, have highlighted the tragic outcomes of not testing properly. A child with pneumonia might exhibit the same sweaty brow, the same body aches, the same weakness that is associated with malaria. In an area where parents are used to hearing malaria, 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 especially if they see mosquitoes around, they might assume that is the one and only culprit. So they go to a pharmacy and get medication that fights malaria, but not pneumonia. That child's potential to recover diminishes steadily as the clock ticks. Meanwhile, the real infection ravages the lungs. By the time someone realizes the medication is not working, it can be far too late. To put it bluntly, the deeper moral of this new push in Lagos is that we must always look beyond first impressions. Fevers do not come with "this is malaria" written on them. They are simply a natural response to infection or inflammation. Pinpointing the correct reason for a fever has to be done through observation, testing, and careful analysis. The days of guesswork need to end. Test, treat, track offers a structure for consistent decision-making. If the rapid diagnostic test for malaria comes up negative, a physician must pivot to the next line of investigative possibilities. That might include a chest examination for pneumonia, blood cultures to rule out bacterial infections, or a recheck of symptoms that might indicate a viral illness. Interestingly, the approach might also help tackle the stigma or confusion around other undiagnosed fevers, which in certain communities might have been incorrectly labeled as malaria for decades. People will come to understand that the underlying cause could be gastrointestinal infections, dengue, or something else. And as knowledge grows, so does the potential to treat quicker and more effectively. We might even see a shift where local health outreach teams can map out diseases that were previously missed, leading to more robust data for city planning. That data can guide investments in sanitation, improvements in water supply, or expansions in pediatric care, especially in areas plagued by pneumonia or other respiratory infections. Throughout this entire story, one of the most compelling threads is the idea that we are not just dealing with a local phenomenon. Yes, Lagos is the immediate stage, but misdiagnosis of fevers and the over-reliance on antibiotics or specific malaria treatments is a global predicament. If the solutions being tried in Lagos prove successful, they can serve as a model for other cities, counties, and countries across Africa and beyond. Lowering the malaria burden is, of course, still a priority in locales where the parasite truly thrives. But advanced diagnostics can differentiate where malaria is actually the problem versus a small fraction of fevers that has been overshadowed by tradition. It also ushers in a new era in which awareness of antimicrobial resistance becomes part of everyday conversation. No longer can we pretend that telling people to, just in case, take a dose of anti-malarial or antibiotic is harmless. We have learned from many examples worldwide that microbes evolve, and every time we misuse or overuse medication, we give these microscopic adversaries more room to sharpen their defenses. This truth may not always be as dramatic as a sudden outbreak of antibiotic-resistant bacteria, but the slow build of more resilient strains can creep up on us. Over a decade or two, we might realize that we squandered our most powerful drugs on imaginary fevers and self-misdiagnoses. Now, if you have stuck with me so far, you deserve a pat on the back. This is the cutting edge of public health debate, and it takes a significant amount of curiosity and patience to absorb. Looking into the future, a scenario emerges. With test, treat, track, people can manage fever cases more systematically, quickly ruling out malaria when it is not present, giving the correct medication for pneumonia or other bacterial infections, or identifying viruses that require supportive treatment. Over time, the city's overall illness patterns become clearer, allowing for more strategic distribution of resources. You can expect fewer hospital admissions from complications of untreated pneumonia or typhoid, thereby saving healthcare dollars and precious human lives. That is the dream scenario. Indeed, a dream that is within reach if the entire pipeline, from doctors to pharmacists to everyday individuals, embraces the rationale behind testing. Imagine the relief for parents who have always dreaded the worst whenever their children spike a fever. Rather than panicking, they might see a future in which a rapid test is administered, the results come back negative for malaria, and a physician can swiftly investigate other causes. No more guessing games and no more wasted days on the wrong medication. For anyone who has ever anxiously stayed up all night while a loved one suffered from a fever, that kind of certainty and speed can be a game changer. It opens the door to interventions that can reduce or even avert serious complications. Above all, we should remember that while the new data is indeed surprising, it is also a sign of progress. The fact that 95 out of every 100 fevers in Lagos are not malaria means that decades of concerted efforts to bring down malaria prevalence is paying off. It indicates a health landscape in which other challenges might rise to the forefront, especially in dense urban environments where public health hazards abound. But it also serves as a clarion call that complacency is the enemy, because if we do not adjust our perspective based on this new understanding, if we continue prescribing or taking anti-malarial drugs blindly, we might squander the very success that made malaria a smaller problem in the first place. In conclusion, the conversation surrounding fever diagnoses in Lagos is not merely about one city or one disease. It is a microcosm of a much bigger debate about global health priorities. The future, however, looks hopeful if we embrace targeted solutions that rely on scientific testing rather than assumption. From the city's vantage point, adopting test, treat, track might help them not only keep malaria numbers low, but also reduce the destructive toll of untreated pneumonia or other overlooked illnesses. It might also make a meaningful dent in the looming crisis of antimicrobial resistance, ensuring that life-saving medications remain effective for those who truly need them. So, here we stand at a crossroads, with one option leading us to cling to outdated assumptions about fevers, and the other guiding us toward an era of swift, nuanced medical innovation. I, for one, am both excited and anxious to see how Lagos charts its course forward. If you have found yourself inspired or alarmed, or perhaps both, by what you have heard, do not hesitate to pass it on. Knowledge is power, and the more people become aware of the real cause behind the majority of fevers, the better equipped they are to demand proper testing. Ultimately, it is about saving lives, preserving the potency of our medicines, and ensuring that nobody's loved ones die simply because everyone assumed it is just malaria.